So Christina Braga from Assured Partners, Wendy Eli from Assured Partners.
Recovering from eye surgery, the sunglasses are not a statement.
So we're going to go through your MVP medical plan. We're going to touch on your dental and vision plan. But jumping into 2024-25 plan costs and outlook. So Norwich as a district, as a whole, received a 31% increase for the medical renewal. Now, what does that, or what are the reasons for that? So what is driving our claims activity? So Norwich is considered an experience rated group, which means how we're using the plan determines what increases we're getting each year. So what was driving claims this past year? We've identified a couple of reasons. High cost claims being one, musculoskeletal conditions, more expensive prescriptions, and also the sites of care that are being used. So what we're going to identify through this presentation, in addition to going into detail about how the plan works, is we're going to identify things that we can do as consumers to change the trend of how things are going. So helping folks to understand options and make informed benefit decisions, downloading or registering for the GIA service that you have, being able to shop for medical services, visiting a primary care provider, making sure your annual screenings are all up to date, choosing generic prescriptions whenever possible, and then of course utilizing mail order prescriptions. But we're going to get into that. So your medical plan is still the PPO. HDHP stands for High Deductible Health Plan. But as we know, even though there's a high deductible behind the scenes, the district is funding those accounts for you so that you have essentially no out-of-pocket. So the deductible is a $5,000 single, $10,000 family, and the out-of-pocket limit, which is the most a person can spend on the plan, is $6,450 an individual, $12,900 a family. Again, all of that is pretty much funded by the district as long as you're in network. Then once your deductible is met, or if you meet your deductible of $5,000 or $10,000, certain co-pays will apply. So you'll see an asterisk, primary care visit, asterisk, $35 copay. So deductible is always first. Should you meet your deductible, then certain co-pays or co-insurance would kick in. That's how this plan works, okay? One thing I do want to point out is GIA virtual care is $0. So we're going to dive more into the health savings account, but if you're a person who has a health savings account and you have that same sinus infection you have had every year and you could get that service for $0 instead of paying towards your deductible, you might want to do that because the health savings account is like your bank account, the money you get to keep. We're going to dive into that in a bit. Wellness benefit, a great benefit, $600 per contract per year. So that means there's a slew of wellness benefits, social, a lot of great benefits. We actually brought a flyer with us, but we'll make sure that's posted. You can reimburse yourself for activities you're probably already doing up to $600. So please take advantage of that. It's a severely underutilized benefit, and I'm sure everyone probably has something on the list that they would want to do or probably have already done.
Is there a time limit for that reimbursement?
I believe so. We'll make sure that we get you that time limit. It could actually be on the flyer.
It might be right on the flyer.
Yeah, we'll make sure we get you that time limit for reimbursement. As far as prescriptions are concerned, everything applies to the deductible first. If your deductible is met, generics become $10. Preferred brand drugs become $30, non-preferred become $50, and then mail order is also a corresponding copay here. You can see $25 for generic, $75 for tier 2, which is preferred, and $125 for tier 3, which is non-preferred. Okay. I like to work in visuals, so we figured we would make your plan a visual representation because it can be a little bit challenging to understand how it works. It's a really great plan. We want to make sure everyone understands how it works. On the left-hand side is a single example. So from $0 to $1,600, the district is contributing $1,600 to a health savings account if you have the HSA HRA model. That money is increased over last year. That money is yours as a member. So again, it should be treated as a bank account. If that's my money, how am I going to spend that wisely so that I can build that into when I post 65 and then potentially pay premiums with it or pay my dental expenses or other things in retirement? You can see after $1,600, Then the district contributes $4,850 to a health reimbursement account. At that point, it flips. So when you have your HSA, you're swiping away. You should always be aware of your balance though, right? Because there's a point, if you do reach that $1,600, it flips. The card is then only active for prescriptions. Medical services are automatically taken into account and paid directly to the provider, okay? So two things, HSA is like your bank account and monitor your balance. Those are the two big areas that we tell members on this style plan. Should you meet the $6,450 of your in-network deductible, everything is covered in full by MVP after that. So there's no more HSA money for you. The district has paid out all of their HRA money, but then the plan will pay the rest. So the only time you'd have expenses is if you were out of network. Okay? On the family example, works very similar, just the dollar amounts are different. So $3,200, the district contributes into an HSA, which is increased from last year. That is your money. Should you reach the $3,200, the district contributes up to $9,700. And I want to emphasize on the HRA, as you know, it's only if you need it. Okay, there's no rollover component to that. And providers are billing MVP directly on the medical. The card is for prescription. Okay. So we talked about how the information is increased. MVP is tracking your medical and prescription charges that go towards your deductible. We talked about when the HRA is activated. MVP is doing that behind the scenes. So as a member, you just have to monitor your balance to know when you're getting close. That's your job as the member. You do continue to use that debit card to pay for prescriptions. Again, prescriptions only on the HRA piece should you get there. And the HSA piece belongs to you. So if you only ever go to your preventive visit, maybe get a couple generic prescriptions, the rest of that HSA money belongs to you and keeps rolling. If you're a person that does the HRA only option, so this is an option, typically it's for people who are not eligible for an HSA, but you might just prefer to have one method. Maybe you don't want to watch your balance. Maybe you would just rather have the same method throughout. You would choose this HRA only option. If you're not eligible for an HSA, here are some bullets to identify if you might not be eligible. If you cover a dependent on your family plan that's not or will not be on your tax return, you technically probably want to do this HRA only option. If you're on Medicare, Medicaid, or receive VA benefits, or if you're covered under maybe a spouse's plan, maybe they have a health savings account. These are just a couple of examples. So if any of these apply to you, you're definitely going to want to enroll in the HRA only option, which is the same plan design. As you can see to the right, the dollar amounts are the same. The only difference is right from $1, the card will only work for prescriptions, and the medical will automatically be paid to the provider when you have a service.
I have a question about that.
Sure.
So I do have the HRA only plan. And when I started that, my children are 28 and 36, so they're not dependent on me. But I was under the assumption that that was the only option I had. Is that correct?
Do you have any kind of, so you're not enrolled in Medicare, Medicaid? Amanda, can you think of any other reason?
No. Because I only would be eligible for the HSA. Right.
I have an HSA.
Yeah, no, I was only told that I could have the HRA.
But you have your husband on your HSA?
Yes.
Does he have another high deductible plan or something like that potentially preventing, so he has no other coverage?
It's completely on my plan.
So it might be something we explore during open enrollment, and if you've talked to your accountant and he doesn't think you have any reason not to be on an HSA, I say he or she,
Right.
then maybe it's something we can
So
explore.
that's July, right? The enrollment is July.
So it's May 15th to June 15th, so July 1 is the kickoff of the plan.
That's right now.
Happy open enrollment.
Starting tonight.
Today is our kickoff.
Yeah. Okay.
Yep, and the only other thing is, will you be 65 within the next year?
No.
Okay, so then,
62.
yeah, so then I would say, just make sure your accountant doesn't see any reason not to, and it's something you could probably,
Okay.
yeah. So that's the visual on the HRA piece of
Now,
things.
the health savings piece, are we still with MVP? I'm kind of confused about what are we?
What are we? Yeah, so on the health savings account, it is a vendor through MVP. Now, those vendors, no matter who you're with, can change.
Okay.
So yes, it is MVP's vendor. MVP is connected to the HSA and the HRA. But
Now, are you getting new cards in the mail or anything?
As far as HSA cards,
Anything.
so we've not been made aware that there's new cards. If you would get new cards, it would be because of like a DFS requirement, which is Department of Financial Services, but we can check on that too. We'll make sure we relay that to the team if you are gonna get new
I
cards.
think I need new cards, I guess.
Oh, okay.
Okay, because I thought we were switching out of MVP. I don't, so confusing. I was like, oh, what is
Okay, and yeah, if you need new cards, actually one thing we're gonna talk about, there's a little business card over there. We've got a customer care center. All you do is, oh, perfect, yep. All you do is call them up or email them and just say, my name is ABC and I need a new ID card. And they'll get you one with whatever service you need, whether it's medical, dental, vision, okay? So under the HRA, just wanted to reiterate how providers get paid. So when you go to the service, you're presenting your MVP ID card as you always would. Providers are submitting the claims to MVP. They're gonna determine what the cost is or what discounts are available. In the meantime, you can always keep an eye out for your explanation of benefits. It's really good just to be aware of the services that are coming through. Providers sometimes do send a bill before the payments are received from MVP. So keeping an eye on your explanation of benefits, holding tight, waiting until it shows in the account. But you can create a My MVP Healthcare account, and you'll actually be able to check balances, see what services were billed, payment amounts, and what was posted. So let's say I get a bill, I wait a couple days and I check my website and I see it has posted, then I don't need to worry about it. But if I check my balance and I'm still not seeing anything, our recommendation would be one of two things. Bullet number 5. You can email our customer care, which I just mentioned, and say, you know, I've been checking my balance and I don't see anything posted, can you help me? Or you can go right to the My Spending account at MVP Healthcare and ask the same question. It's just a matter of preference. And then the MVP person or our customer care person will get back to you with if it's been posted and when and give you those details. Okay? Providers should not require payment at the time of service, but if they do, we can let MVP know. Another thing our office has done is we've actually provided them a letter on district letterhead with how the plan works, because it is very unique. Most of the commercial plans don't have this element. So we explain to them how the plan works, when they'll typically receive payment, and most providers are actually okay with that because they've got something official from a school district on letterhead. So our office, our customer care, would coordinate that if your provider is ever giving you an issue about, you know, I need payment up front for this surgery. We would help you with that. Okay, health plan education. So we talked about our claims being high, and sometimes we don't realize that how we're using the plan, like I said, generates the increases that we're getting each year. So we just wanted to share some consumer information just to help everyone learn a little bit more about the inner workings of the plan. So this is Steve. Steve has a sore throat. What a lot of people don't realize is that if Steve decides to go to the ER to take care of his sore throat, that's about $2,000. So if I'm an HSA person, do I want to spend my whole HSA and sit in the ER? Not me, I'm a bargain shopper. I would probably use the GIA option, which is free. I can talk to someone online, I can get my script, and I can be on my way, and I can save my health savings account money. Or, even if I didn't use the ER, I could use an urgent care, which on average is $430, or even a physician's office, which is $107. So I get to determine how I use my money, and I will share some information. In the last 12 months, we look up avoidable ER visits, and the district members had about 105 visits that were deemed non-emergent, which means headache, sinus infection. So about $210,000 really could be free if we did GIA, or even, you know, cheaper if we did physician's office, but I don't think a lot of people realize that. So we just wanted to bring that to light. ER visits were definitely an area of, I won't say concern, but of increased cost, because the year prior there were only 56 non-emergent ER visits, so we doubled over the last 12 months. So we wanted to share that information, and Wendy is going to share information about GIA, which I keep rambling about.
So now I get to ramble about it. So as Christina highlighted, GIA, it's GIA by MVP. It's an app that you can download to your mobile device. It allows virtual services at no cost as many times as you need. So there is no cap for the year. You would use GIA for urgent care with a phone call, a great option, cold and flu symptoms, earache, pink eye, minor injuries, even urgent prescription refills. There is no need to wait in the doctor's office or travel with a sick child. Great and terrific option for college students away from home to receive care. So obviously something you want to set yourself and them up with ahead of time, get registered, have that app available so when you are sick, there's no stress. The GIA app shows the wait time, and that is something that's available 24/7. So as Christina mentioned, with the, excuse me, with the emergency room, great way to avoid sitting in an emergency room. Everyday primary and specialist healthcare with in-app messaging is also something located in the app. These can be for management of health concerns like diabetes, anxiety, or high blood pressure for ages 18 and up. These can transition to a video call if needed or referred for in-person care. One of the other things you'll find in the app is behavioral health care with video appointments. These are available without a referral for therapy and medication management. Behavioral health care is available for ages 12 and up. Psychiatry services for ages 18 and up. The My Visit Now video calls can also be used for nutrition and lactation consultations. Besides easy access to medical care in the palm of your hand, anywhere and anytime, GIA allows you to view your member ID card. You can find a doctor near you, and you can even estimate the cost of treatments. GIA information items are also available on their website, but the virtual care options that I just mentioned are only on the GIA by MVP app. When your medical care need isn't urgent, the medical cost estimator allows you to compare pricing from different providers to help you choose what best meets your needs. This may be an instance where the website may be a little easier to utilize if you're searching providers and pricing. However, it is still available on the GIA app.
And I'll just pause here, again, thinking of the HSA in my bank account. If I know an MRI only costs $400 at this vendor, but $5,000 at a hospital, and it's the same MRI for upper limb, I'm gonna go to the cheaper one, right, to try to save my money. So this is a great tool to really, literally shop around for your medical services if it's pretty much the same no matter where you go. Okay, preventive care, we mentioned earlier that driving claims is high-cost claimants. So one thing we want to make sure of is that everyone's getting their annual physical every year, but you're also keeping up to date with preventive screenings. This presentation will be available on the online portal, probably on the district website or other means. So you certainly can get these details, but we want to make sure, with the pandemic, a lot of people got behind in their screening. So we encourage you, please make sure that you are up to date again with your screenings. Early detection is good for the person, and it's also good for your plan. It helps to keep your costs down. Prescription alternatives, we could go on all day about this, but I promise we won't. Always checking out generic alternatives is going to be the best for you. Utilizing mail order is also going to be the best cost because you're getting a bulk amount, so you're going to get a deal on prescriptions, even if it is towards the deductible. A lot of people don't realize the cost of prescriptions. Here's a couple of examples. So a blood thinner, warfarin, very common, $168 annually. Xarelto, which is a brand, about $4,200. Again, in this instance, you're going to be blowing through your HSA and part of the HRA. Metformin is actually a generic medication for type 2 diabetes. Most people don't realize a 500 milligram pill or two 500s is about $240 per year. 1,000 milligram can be upwards of $30,000, and it's a generic. So you wouldn't think it could be $30,000, but it can. So advocating for yourself when you go to the doctor, asking for generics, asking for lower cost alternatives, because a lot of the drugs are very very clinically effective, and they all do the same thing. Just a few more examples, with rheumatic disease, anti-psoriasis, methotrexate is a great first step. A lot of times people will be prescribed the brand out of the gate, but why not try the generic? If it's softer, if it's cheaper, see if that works before we're stepping up. In this case, methotrexate's less than $1,000 per year, and you can see, Humira and in this instance, Stelara is $45,000, Humira $64,000, but Stelara can be upwards of $200,000. So what happens is you're paying, the district is reimbursing that in the HRA and HSA, but then MVP picks up the rest. And those costs are what drive our renewal each year, right? Now, of course, if you have to have it, that's what we have insurance for. But if we have a choice and we can be a wise consumer maybe by trying generic, that's going to benefit the whole group. Okay, dental plan we're going to whiz through because we've got about 3 minutes.
Oh, boy, okay. So the district does offer 3 plan options, a low, a mid, and a high plan. Your open enrollment email is being sent at 4:30 today, so when you log in to make open enrollment changes, you'll see the options that apply to you. Because we always recommend in-network, that gives you the most value, so we're going to highlight just those in-network columns. Your preventative and diagnostic services, like twice-a-year cleanings and x-rays, those are covered in full at participating providers for each of the 3 plans. In-network basic restorative services like fillings are covered at 50% for the low plan, 80% for both the mid and high plan. The major restorative treatments like crowns would be covered at 50% for all 3 plans. There's a $50 per person deductible each year. That does not apply to preventative services, so if you're just having your cleanings each year, you will not have to pay that $50. The maximum coverage amount that's available is $1,000 per year per person for the low and mid plan, $1,500 on the high plan. You'll see the high plan also does offer orthodontia services, and there is a $2,000 lifetime limit on that. Anytime that you have treatments that would be in the basic restorative or major restorative categories, you do want to ask the dentist to give you an estimate for that, so that you know what's coming on the day of service. I do want to point out those percentages in the out-of-network column can be very confusing. They look the same as the in-network side, but the out-of-network providers don't have agreed-upon pricing with Guardian, so you would be having to pay the difference between what the provider is charging and what Guardian has decided is a fee schedule, an average rate for that area. And when you're looking for an in-network dentist, you would visit guardiananytime.com. Quick with our vision as well. So for those interested in the vision plan, the district offers Guardian VSP. That's what we refer to as a 12-12-12 plan. That designates that the exams, the lenses, and the frames are all available once every 12 months. Again, we'll focus on the in-network column. Eye exams are $10 and available once per year. Copay for materials is $25. That does apply to single, bifocal, trifocal, and lenticular lenses once a year. Elective contact lenses has a $200 allowance per year. You could be responsible for the amount over that. Medically necessary contact lenses subject to the $25 material copay. Your frame allowance in network is $200. Of course, you could select something different and just pay the difference over the $200. Lots of asterisks in the out-of-network column that indicates you would be responsible for any amount over what is shown there. That's why choosing in-network is always to your benefit. So to find an in-network vision provider, again, guardiananytime.com. Those links are right on the top corner bar of the website.
Okay. Really quickly, flex spending account or FSA. Oh boy, it's angry. Flexible spending account, just a general FSA is for anyone who's not on the high deductible, so maybe you take coverage elsewhere. You do have the opportunity to join the general purpose FSA, which is for all IRS eligible expenses. Limited purpose FSA is if you are enrolled in the high deductible plan, you'd need to enroll in the limited purpose FSA, which covers dental and vision expenses. And then there's also the dependent care FSA, which is open to anyone. It doesn't matter what plan you're on. This is to pay for child care providers up to $5,000 per year. And we're going to take questions today, but if you have any questions after we leave here or any time Monday through Friday, 7:30 to 5, you're welcome to call our customer care team. They're folks that work with school districts and actives and retirees all day long. So you can give us a call or email, whatever your preferred method is, but please do take a card for sure. Keep it in your wallet and let us know if you have any questions at all. They also have this presentation, so they'll know exactly, what slide you're referring to or what your question might be. Happy open enrollment. Today's the day.